1440 KVON 99.3 The Vine. This is Kelly. It is time for Healthy Communities, brought to you by St. Helena Hospital. And you know, we're just coming to the end of the month here today, and it's American Heart Month. So what better way to end the month than to talk about heart health with Dr. Sakopoulos. Good morning.
Good morning.
It's great to have you here.
Thank you for having me.
So let's talk a little bit about some of the statistics about heart disease, because it seems to be somewhat prevalent in our country.
You're absolutely right. Indeed, in the Western world, heart disease is the leading cause of death. And when we talk about heart disease and the death caused by heart disease, that includes not just the heart, but the entire cardiovascular system. So, for instance, the leading cause of death is heart disease. The second leading cause of death is cancer, all types of cancer. The third leading cause of death is strokes. And we include strokes in the whole realm of cardiovascular disease.
Oh, really? So are there some of the same, when you talk about prevention, or you talk about, it's some of the same prevention tips, and it's all connected?
You're absolutely right, Kelly. Yeah. So the same disease process that affects the heart affects all the arteries of the body, including the arteries that go up to the brain. And so the disease process is called atherosclerosis, and essentially it's the thickening of the arteries. So the arteries are conduits that bring blood from the heart to the various tissues in the body. And with time, and we'll talk about the risk factors, these arteries get thickened, and the lumen, that is the space inside these tubes that carry blood, gets more and more narrowed as plaque grows, essentially. And it can get to the point where the arteries are completely blocked up. So if that happens in the arteries that go to the brain, people get strokes. If that happens in the arteries that go to the heart, people get heart attacks. It can also happen in the arteries that go to the legs, and that can cause something called claudication, which is essentially pain when people walk. And unfortunately, sometimes that can actually lead to amputations. The arteries that go to the kidneys can get blocked up, and that can be one of the causes of renal failure that leads to dialysis. Anyway, every single artery of the body can have problems. In fact, another area that has not been looked at in the past but is gaining more attention now is it can even, in other words, the arteries that go to our genitals can be involved, and that can lead to impotence in males. The arteries,
is that also a life-threatening situation? Like I imagine if any artery is being blocked off, that's got to be life-threatening, right?
You're absolutely right, depending on what organ is involved. So if it's the arteries that go to the legs, you can lose your limb. But if it's the arteries that go to your heart, you can get a massive heart attack and die from that.
I see.
Absolutely. Now, I've actually mainly talked about atherosclerosis, which is this narrowing of the arteries. The same thing can happen, but in a different mechanism. In other words, you can develop an aneurysm. An aneurysm is when the artery doesn't get narrow, but it gets enlarged, and it can continue to get more and more enlarged, and plaque can break off and plug things up downstream, or this artery can actually rupture, and that happens.
Because I've heard of an aneurysm, but I guess I didn't know exactly what it was, what was physically happening there.
An aneurysm is nothing else than an artery that's gotten much bigger than it should be. And usually if it's twice its normal size, that's considered an aneurysm.
So when you talk about risk factors and prevention and all that, are they two different categories for aneurysm as opposed to heart attack or the thickening? You have the thickening and you have the enlarging.
That's a very good question. So first I'll talk about the risk factors for the narrowing of the arteries, that is the atherosclerosis. The main risk factors are high blood pressure, smoking, diabetes, family history, high cholesterol, probably diet as well, and stress. Those are all the risk factors. So if patients have significant heart disease from atherosclerosis, they usually have 1, 2, 3, or more of these risk factors.
I see.
When it comes to aneurysms, really the predominant risk factors are family history, high blood pressure, and smoking, those three. So in other words, if you have diabetes or any of the other risk factors I mentioned, you're not more prone to have an aneurysm. But the other risk factors do predispose you to atherosclerosis.
So some of the prevention's obvious, like don't smoke or stop smoking, right? But what are some other prevention
Well,
ideas?
there's no doubt that some things, for instance, exercise, does a lot of good things for you, because if you do have diabetes, it gets your diabetes under better control. If you have a little bit of high blood pressure, you can help reduce your blood pressure with that. If you're obese and you exercise, you can drop your weight, and that can help you all around. So there's no doubt that there are some things you can do and some things you can't do. You can't, for instance, alter your genetic makeup.
Right.
So you've had a lot of great traits passed on by your parents, but one might not be, good genes in terms of heart disease.
Right.
However, quit smoking, and it's never too late to stop smoking. And if you, like I said, if you're overweight, you need to lose your weight, get into exercise. The other thing I'd like to mention here is there is something called prevention, or primary prevention, and there's also secondary prevention. So my point is, so here I was, I haven't been taking care of myself, I get a heart attack, so it's like, well, I'm done, I got a heart attack. No, you had a heart attack, hopefully some treatment was done for that, and at this point, it's not too late. Maybe you're middle-aged, maybe you're in your 60s, okay, it's not too late. Stop smoking, get your life back together, and you can prevent a repeat heart attack or perhaps a stroke or something. So it's very important to not give up.
So you mentioned diet. I think that's something that most of us in this country have a lot of trouble with. We go on diets. We might just say, oh, okay, I'm going to cut back. How do you find, where is that healthy diet, that heart healthy diet?
That's clearly a problem in our society, and I think the concept of going on a diet is probably not as effective as changing your lifestyle. And if you feel like modifying what you eat is a pain and you don't really like that, you're probably not going to stick to it. So I think what you need to do is figure out that, for instance, you can have a salad and not smother with a bunch of
ranch dressing or something.
Exactly. And you can
Not
eat.
that I've done that.
Exactly. But you can have some nice olive oil and maybe a little bit of balsamic vinegar. And in reality, if you haven't had olive oil and balsamic vinegar, then you're probably going to have to modify your taste with time. But eventually, with time, you'll figure out that actually tastes better. It's kind of like, milk. I don't drink much milk, but, I like to throw in a little bit of milk in my coffee. Well, when I first did that many years ago, to me, it was whole milk or nothing. And with time, I'm using skim milk, and I actually prefer that. And if I have cereal, I like soy milk. I actually prefer soy milk right now, and nobody's telling me to say this. I actually prefer soy milk than regular milk with my cereal. So I think with time, your taste can modify. Whole wheat versus white bread. As a general rule, what I would say is think about how they eat in the Mediterranean. The Mediterranean diet is without a doubt the best diet there is. Of course, I'm sort of partial to it because I'm Greek-Italian. But
Dr. Sakopoulos, we should say here. Interject, remind people just tuning in.
But so it's very healthy, and it's also very tasty. So the main aspects of a good Mediterranean diet are minimal amounts of animal fat. It's not a vegetarian diet. So once in a while you can go out and, eat some red meat, but it shouldn't be something on a regular basis. Your protein should come mainly from fish, chicken, and also some of the vegetables like beans. Those actually have a relatively high source of protein intake. And in terms of your carbohydrates, not simple carbohydrates that burn up quickly, kind of like, sugars. It should be more like the whole wheats, and those are better sources of carbohydrates. And in terms of fat, minimize animal fat. It should be mainly vegetable fat, because we do need some fat. But it should be more olive oil, vegetable oil, rather than butters.
Right, absolutely. That's helpful. That gives us a good start. Let's talk for a minute just about some of the types of surgeries that you perform.
Well, I'm a cardiovascular surgeon, which means I'm the guy that does bypass surgery, valve replacements, bypasses in different parts of the body. In the old days, what cardiologists did and heart surgeons did was very clear. Cardiologists would, put catheters in patients, that is, little tubes, inject dye, and if the arteries were a little narrowed, they would open up with balloons and then remove the balloons, and that would allow the artery to, expand. Then what happened was they developed something called stents, which are essentially little, I call it really expensive chicken wire. That's what it is. You put these little tubes of metal, and they are mounted on a balloon. The balloon goes where there's a narrowing in the artery. The balloon is cranked up. The stent is deployed, and it sort of stents open that narrowed artery. Does that make sense?
Yeah, it does. I'm picturing it right now.
So it's like a little tube.
So it's opening. So this is a narrowed artery, and it's narrowed with plaque.
It's narrowed with plaque. You so insert it inside through the narrowed artery.
Right, and then you can open it.
And then you crank up the balloon.
That's amazing.
Pops it open. And in the old days, you'd remove the balloon, and there could be some recoil. That narrow area would get narrowed again.
Right.
But now that we put these little metal stents, it stents
It
that
stays,
little artery open.
so it's
exactly.
open. Okay.
So stents began or rather the deployment of stents began in the coronary arteries. Now we're putting stents in the arteries that go to the brain, in the arteries that go to the kidneys, the arteries that go to the legs. And the truth of the matter is, in addition to balloons and stents, there's all sorts of different devices that, like little rotor-rooter devices called atherectomy. We use a lot of atherectomy devices that are planers and drills that clean up these arteries from the inside. And we've gotten really sophisticated where we have these little parachutes inside the arteries that can trap any debris that falls down so it doesn't go distally into the arteries. So we can suck up a lot of this plaque, which is made up, by the way, I didn't mention this, we were going to talk about this. What is plaque? It's essentially cholesterol, blood clot, and calcium. That's essentially what it is.
Oh, I was kind of wondering, was the plaque on the teeth or what? Well, we've been speaking with Dr. Sakopoulos this morning. So much great information. I appreciate you coming in. You can get more information and contact the doctor, sthelinahospitals.org. And this is Healthy Communities brought to you by St. Helena Hospital. And thank you for being here.
My pleasure. Thank you.